Hey, folks, Dr. Joe Esposito here. Glad to be with us today. We're going to start the show out today by talking about supplements that everybody should be taking because I get the question multiple times a day. People say, well, Dr. Joe, what should I be doing? What should I take? What's my first step in getting my nutrition right? And so we're going to talk about that today because there's several things that you should be doing right away. And supplements, of course, if you've listened to the show before, you know I'm a huge proponent of supplements. I take supplements every single day. And I think you should too. But the big question comes up as to what should I take? And how do I know what's good? How do I know what's bad? Am I taking too much? Every day, patients come in our clinics and they have bags of supplements and they say, what should I be doing? And we lay them out and I go through this constantly and my staff does too. And we'll pick out and say, okay, this is a good one. This isn't such a good one. You don't really need this one. Finish this one up. You don't need any more of it. But a lot of times you'll read an article and say, I need this, and you just start getting a little crazy. I don't want you taking too many because you can overdose on supplements too, but I want to make sure you're taking only the best quality. Now, taking supplements become very popular in treating a lot of different health issues. And so there's a lot of supplements on the market today. I want to try to weed through some of that junk, some of that noise you're getting and what you should do. So to help you out, what I've done, Joe and I, we've compiled a list of supplements that everybody should be taking to improve their health. Now, it's always a good idea to check with us so we can do a further evaluation to see if you're getting everything that you need. This is the general cookie cutter plan that works for most people, and most people need at least this as a base. And then we could always expand that base if we need to, and that's when you want to come see us and we can do an evaluation. We can do an algorithm. We fill out a questionnaire. We can figure out some symptoms there. That's how we usually start. If we need to dig a little deeper, we can do an analysis. We can do blood analysis, something called a micronutrient test to determine if you have any specific nutrient issues, oxidative stress, the immune system. That's kind of a cool little test. We can do a hair analysis. I found out when I did my hair analysis years ago that I was low in selenium. So I was starting to turn gray, and I started taking selenium, and no gray hair. So that solved my problem. Now, don't go out and buy selenium thinking it's going to be your problem because I don't know what your problem is. I had to find out specifically what my issues were. And so a hair analysis is something else we can do. And on the website, drjoe.com, we have a list of all our services. And if you go into lab tests, click on the tab that says services and scroll down, we have all the lab tests that we can do on you. And we have a lot of them for nutrients as well. So it's really insightful and interesting. We learn, hey, you're in good shape, or hey, you're not in good shape. And when we do the tests, a lot of times people come in, they start with the basic tests, and we do some tests on them, and the tests are fine. And they're like, oh, this is cool. I'm in good shape. I said, yeah, you really are. So whatever you're doing, keep doing it. I hear that all the time from other doctors. Patients will go see their primary doctors or their cancer doctors or their GI doctors. And doctor will say, well, last time you were here, your tests showed this, and now it's way better. What are you doing? Well, I've been following Dr. Joe's plan, and inevitably the doctor's going to say, well, whatever you're doing is working, so just keep doing it. And a lot of doctors know who we are, and they'll say, oh, if Dr. Joe says it, just do it. So, all right, number one, and this is probably a simple one that everybody should be on, is a multivitamin. Now, in theory, it would be wonderful if we can get all the nutrients we need from a perfect diet. Well, unfortunately, I don't know of a perfect diet. The ideal diet would be organically grown raw fruits and vegetables all day, every day. I don't know anyone who does that or certainly does it for any long period of time because it's exhausting. And it gets boring after a while, too, because you can only eat so many salads. So there are raw food classes. I've taken classes. I've learned in my book, Eating Right for the Health of It. We have some raw food recipes in there as well. But you can do simple things like raw hummus, which is really simple to make. You take some dried chickpeas, you get organic chickpeas. I got them at Sprouts last time. Soak them overnight in water, rinse them, and then rinse them twice a day for about 3 or 4 days, and they will actually start to sprout. And when they sprout, you put them in a food processor, add some little seasoning to it, and you can make raw hummus. Just look up a recipe. It's really easy to do. It has a different taste than regular hummus. It tastes more raw, if that's such a thing, but it has all the enzymes available. And that's the key when it comes to supplements. I'll talk about other supplements, but enzymes are going to be the missing link. Enzymes are the thing that makes everything else work. Because really, all you are is a sack of chemicals. We can break you down, and you can look up online what chemicals are in my body, and they'll even say, well, your body's worth $24 in raw chemicals or whatever it is. But what makes it come alive? Well, the nervous system and the enzymes. And so if you're eating cooked food all day, every day, which a lot of you are, the cooked food is not going to give you the enzymes that you require for the body to be healthy. And as we get older, our enzyme levels start to plummet. And so we want to get those enzyme levels up. So a good multivitamin is really important, but you want to make sure it has some enzymes in it and some raw products as well. When I designed Dr. Joe's Essential Source, which is our flagship product, I said, well, how can I make the world's best supplement? And so I took raw fruits and vegetables, juice them, take the water out at a very low temperature, and what's left is a powder. Then we add prebiotics, probiotics, digestive enzymes, a complete multivitamin, no synthetic ingredients at all, including the vitamins. And so I consider Essential Source, that's why I call it, get your essential nutrients from the source. I came up with that name, most creative thing I ever did. So we came up with the Essential Source product, which is really the minimum supplement everybody should be taking. And I take it every day. It's a scoop. It's a powder. I just mix it up with coconut milk, almond milk, frozen banana, frozen berries, and I add something called super greens to it. Super greens is wheatgrass, barley grass, alfalfa grass, chlorella, spirulina, omega-3 fatty acids are in there. About once a week, somebody says, but Dr. Joe, you tell us not to eat wheat, and now you put wheatgrass in your super greens. What's wrong with you? Very accusatory, by the way, too. Folks, you have a question, don't accuse somebody of it. Just ask the question. And I say the wheatgrass doesn't have gluten in it. Because what happens is when the grass grows, it hasn't developed gluten yet. When the wheat starts to develop berries, that's when you start to get the gluten. So, yeah, I can't say it's gluten-free because it does have wheat in it. But in all the years I've been in practice and all the people I've dealt with celiac disease and gluten intolerance, nobody has ever had a reaction to it, ever. So I consider super greens an essential source, the minimum supplement you need every day, and that's your multivitamin. So if you're taking that, you don't need to be taking other multivitamins either because that solves your problem. So again, I wake up every morning and I just look forward to my super greens and essential source to start my day. Some people look forward to coffee. Once you get on super greens and essential source for a couple of weeks, you'll forget about your coffee probably. Most people do. Omega-3 fatty acids also are essential. It's called an essential fatty acid for a reason. Essential means you can't make it yourself. You have to get it from an outside source. So we have to get omega-3 fatty acids from an outside source. And there's three sources that people think about when they think about omega-3 fatty acids. What's the number one? Number one would be fish. People think about fish oil as an omega-3 source. Excellent source of omega-3s. However, it's not an excellent supplement. And the reason is, most of the fish out there is going to be contaminated with heavy metals or radiation even. So fish is not a good choice. And the fish oil it has to be converted into something called a phospholipid form. Phospholipid is the form that omega-3 fatty acids get absorbed. So if you're eating fish oil and it has to be converted and it has heavy metals in it and many times the fish oil goes rancid pretty quickly, it's not really the best choice. So I wouldn't suggest fish oil as a choice for omega-3 fatty acids. A better choice would be krill oil. Now, krill look like little tiny shrimp, and they're abundant, huge amounts all over the world. Way less environmental impact from farming krill than it is from farming fish. Because with the fish, you're just taking the oil out. With the krill, it's a lot less waste, let's say. And the krill grow very quickly. And so it doesn't take years and years to grow. It takes probably weeks or months to grow. So krill oil is a better choice. It is in the phospholipid form, so it's a lot easier for the body to utilize. However, here's the catch. Krill don't produce omega-3 fatty acids. Neither do fish. So where do they get their omega-3s? Well, it's essential to them too. They get it from algae. Algae is the purest form of omega-3 fatty acids. And that's what I take every day. I take Dr. Joe's algae oil. I can't imagine not taking my algae oil. It helps with brain function. It helps with inflammation. It boosts the immune system. Like I said, it decreases inflammation, positive effect on depression and mood, makes my brain work better. And I like when my brain works good. So I would recommend omega-3s as part of the minimum protocol as well. Now, the super greens, the essential source of the omega-3s, we have them on our website, drjoe.com. You can order them. We'll ship them to you, or you can come pick them up. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love the opportunity to be your doctors, but I also love the opportunity to get you on some good supplements as well. So drjoe.com, great source of information, over 1,500 hours of podcasts, blogs, articles. You could easily go down a rabbit hole and get lost at the drjoe.com website because a lot of good information there. And if you do have a question, you can always send it to us through the website, drjoe.com, and either me or Joe will answer it as quickly as possible. So we try to get to the answers as quickly as possible. If you send it, we will get back to you. If we don't get back to you right away, it just means we weren't near a computer or we were having a life. Sometimes Joe and I do that. So if you have any questions, you can always send it through the website, drjoe.com. I was just talking to a nurse practitioner earlier, and we were talking about she worked in the VA, the Veterans Administration. And I said, man, I'd love to get my hands on a lot of these veterans. And I do. A lot of you listeners are veterans, and you come to see us. And we certainly appreciate your service, and we appreciate you coming to see us. And she just rolls her eyes. And she said, yeah, it definitely needs some work. And I said, I'd love to get in there and just turn that thing upside down and actually get results for a lot of these people. And again, not saying they don't get any results, but sometimes the veterans may not get the best quality care. Because the doctors many times aren't trained. It's not the doctor's fault, I should say. The doctors aren't trained in functional medicine like we do here. So I'd love to get some more functional medicine training in there. And she says, there's one doctor she works with, and she's amazing, and the veterans love her, and she does a great job. But I digress. And she said, yeah, imagine if we just did something as simple as giving them magnesium supplements. That alone would change people's lives. 80% of adults suffer from magnesium deficiency. Now, magnesium does a lot. It affects the nervous system. It affects muscle contracture, energy production, bone and cell production. And taking a daily magnesium supplement can help things like asthma, migraine headaches, muscle cramping, osteoporosis, heart disease, calms you down, reduces anxiety. But here's the problem I have with that. There are a lot of foods that are high in magnesium, and I wish the doctors would say, yes, if you want to take a magnesium supplement, absolutely, but I'd rather see you add these foods to your diet. And if you add these foods to your diet, chances are you're going to get enough magnesium. And those foods are things like green leafy vegetables, legumes, nuts, seeds, avocados, tofu. Of course, you're going to do tofu. It's got to be organic. So basically nuts and seeds, because tofu comes from soybeans. So you're getting plenty of magnesium if you're eating a plant-based diet. If you're not eating a plant-based diet, you probably should be supplementing with magnesium. But here's how magnesium works. Magnesium can block the absorption of something called glutamate and aspartic acid. Now, if you've listened to my shows before, I've talked about this. Now, I'm certified in traumatic brain injury. And so when somebody has a traumatic brain injury, a lot of glutamate is released into the brain, and when it gets absorbed, it causes pain. So if we can somehow prevent that glutamine from being absorbed and blocking the absorption of it, that can help mediate pain. And that's where magnesium comes in. Same thing with aspartic acid. Aspartic acid is found in big amounts in artificial sweeteners, aspartame. And of the 7 deadly sins, if you're new to the show, I always talk about the 7 deadly sins, the 7 foods you should avoid. And that would be alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I know it's everybody's diet, right? But alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener are the 7 foods you really want to cut back or cut out of your diet. And of the 7, the one I want you to start on right away today, right now, is artificial sweetener. That'll be aspartame, sucralose, saccharin, acesulfame K. These are all artificial sweeteners, and they can have adverse effects on your immune system, and especially aspartame, aspartic acid, can have an effect on your brain. So the number one side effect of aspartame ingestion is headaches. So if you don't eat it, all the better, but if you have an injury, you are releasing glutamic acid from the injury. And people are eating monosodium glutamate, they're eating aspartic acid, and so magnesium can block the absorption of these chemicals, and that can help reduce the pain. So eating a good diet is really the best thing you should do for that. You don't really need a magnesium supplement if you're taking a good, eating a good diet, because you can get it from foods. Now, another supplement I need to talk about is vitamin D3. Vitamin D3, again, is an essential nutrient. Now, we can make vitamin D3 if you're out in the sun, but most people stay inside with clothes on, which is probably a good idea in most cases, most of the day. And if you're outside in the sun 20, 30 minutes a day, several times a week, you might not need vitamin D. But here's how you got to do it. If you're going to get vitamin D from the sun, there's a protocol you have to do. Be out in the sun until your skin starts to turn pink and get warm. That's when you've had enough. Get out of the sun. Don't put sunscreen on, Because you put sunscreen on, it's going to mix with the oils that are being produced on your skin. That's the vitamin D. If you've just got out of the shower, you're out in the sun for a few minutes, you come back in, you start to feel greasy, that's your body interacting with UVB rays and creating vitamin D on your skin. If you shower off right away, you've washed off the vitamin D. It didn't get a chance to absorb. So if you are outside, out 10, 15, 20 minutes a day till your skin gets warm, as much skin you can expose legally, and your hands, your face, your neck, your legs, and then leave that on the skin, it can be absorbed up to 24 hours later. Now, I'm not saying you don't have to shower for 24 hours. I hope you do. But if you don't, you can be absorbing vitamin D up to 24 hours. If you rinse it right away, you're not going to absorb it. So it's important to get your vitamin D levels checked. Normal is like 30 nanograms per milliliter. That's okay. That's accepted as the norm. I don't want normal. I want super health. I like to get my vitamin D levels to about 60 to 80 nanograms per milliliter. And that's where mine is. Last time I had it checked, I was right at 58. So I was right where I should be. And so I supplement with vitamin D every single day. Now, if I'm out in the sun, if I'm going to the beach, if I'm going to the lake, that day I might not need it. But I like to take about 3 to 5 drops of Dr. Joe's vitamin D every single day. I take 5 drops. If you're tiny, you might be able to get away with 3. And a drop is 1,000 international units. So I take 5,000 international units of vitamin D every day. What I do is I take the Super Greens, the essential source. I put 5 drops in it when I mix it up and drink it that way. It has no flavor, but so it's fine. But I want to make sure I have it. Now, here's the thing I want you to do with supplements. I want you to leave them out on your counter. Because if you put them away, you're going to forget to take them. Everyone does. You're not special. Now, if you come to our office and you buy supplements, we can give you a little pack that'll hold 7 days worth of supplements. Remind us, a little plastic container. And that's how I do mine. I lay out my whole week in there, so I know I have 7 days laid out, and I know I'm not going to miss my supplements. So I have my little pack in front of me. I take my supplements, my pill form, then I take the powder as well, mix it up and drink it. And then I put the vitamin D drops in there. So I couldn't imagine not doing that because everyone says I look about 20 years younger than I am. I certainly act about 40 years younger than I am. And one of the reasons is I take care of myself, and I take supplements every day. And I see a dramatic difference when I'm taking a supplement. So I think you should probably consider that as well. Another thing you might want to consider is probiotics. Probiotics are good bacteria because when you eat food, the food goes into your intestines and you chew it, and your stomach acids break it down, and enzymes, protease, amylase, lipase break down fat, carbohydrates, and proteins. But then what happens? The bacteria in your colon, and this is really simplified, eat what you ingest. They spit out what they don't like. That's what you absorb. So we are dead if we don't have probiotics in our body. Pro meaning good, biotic meaning life, in favor of life. So probiotics, good, as opposed to provolone, which is a cheese, but that's another story. And antipasto would mean, no, never mind. Going down a rabbit hole here. So probiotics, very good for you. And I take one every day as well. Now, I put it in the essential source. So if you're taking essential source, you're getting some pre and probiotics. And then I take an additional one as well. And all of those are on the website, drjoe.com. Now, some people say, well, Dr. Joe, my doctor told me to eat yogurt. I was on antibiotics, anti meaning against biotic life. It kills life. And I'm not against antibiotics. Please understand that. If you need them, take them. I've taken them already. If you need them, take them. But my concern is then you got to rebuild your colon. So the probiotics are important. And if you're eating fermented foods, a couple of problems we have. Number one, if you're eating commercial yogurt or kefir, it's been pasteurized. And when it's pasteurized, it kills off a lot of the good bacteria. So that kind of negates that whole purpose. If you're eating something like sauerkraut or kimchi, those can be good, but they have to be raw. If they're pasteurized, kill the bacteria. And also things like sauerkraut and kimchi, very high in salt. And too much salt is not good for you either. So that's why I like to take my probiotics and my essential source as my source. Now, I said earlier that essential source has something called prebiotics. Prebiotics feed the good bacteria. They feed the probiotics. And so they have to get fed so that they can multiply and make little probiotic babies and help you digest food. So it's a specific type of food, the prebiotics, that you can't absorb, but the bacteria can. And so you want to make sure you're getting a good amount of that. So prebiotics really important. Another one I'm going to recommend is turmeric. Now, turmeric, amazing anti-inflammatory. It helps with inhibiting inflammation. It's been shown to maybe help with heart disease, stroke, diabetes, headaches, chronic fatigue, even fighting cancer. So turmeric, we have it in a supplement. It's amazing. Again, it's one of my supplements I take every single day. I have it growing in my backyard, and it's been there for about 3 or 4 years now, and it is growing like a weed. And so if you have an area in your house, you can buy turmeric and just plant it, and it'll grow these beautiful leaves, big, beautiful leaves, and beautiful flowers. So it really is pretty. And then it grows with something called rhizomes. It grows underground and shoots up another one. It grows underground, shoots up another one. And what you're eating is the root. So if you're so inclined, you can grow your own, of course, and then use your fresh turmeric if you want. But that's a lot of work, and it's, if you take the root out, then it doesn't grow again either. So if you're growing it as a ground cover, which is what I'm doing, it looks beautiful. But we have it in a pill form, drjoe.com. And if you want to do a specific analysis to see what specific needs you need, or supplements you need, we can do that for you. In fact, every one of our patients that comes in our offices gets a nutritional evaluation. And we go over the supplement needs with them, and we discuss what we think they need. And then we put them on a protocol, usually 30 or 60 days. I like 60 days. Then we reevaluate, see how you're doing. So if you're serious about wanting to get well, again, these are the supplements I'd recommend everybody do. The Essential Source, the Super Greens, Probiotics, the vitamin D, the fish oil, the omega-3 supplements. And then I take enzymes. I take a digestive enzyme whenever I eat a cooked meal. If you start doing that, that's amazing. So as you get older, your digestive enzymes drop. It's harder to digest food. And if you're eating cooked foods, they don't have enzymes in them anyway, because cooking destroys the enzymes. I take a digestive enzyme with every meal, every cooked meal anyway. For lunch, usually I have a salad, so I probably don't take an enzyme then. But if I'm having a meal where I have nothing raw in the meal, I'll take an enzyme. All those supplements are on our website, drjoe.com. If you want to become a patient, to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. What kind of patients do we see? Pain patients, neck pain, back pain, shoulder pain, sciatica, headaches. We are really good at dealing with pain. In fact, I'm the only chiropractor in the state board certified in pain management. I'm also board certified in orthopedics. I'm double board certified in nutrition. Of course, I'm certified in chiropractic, traumatic brain injuries. So we're really good at evaluating and diagnosing and getting to the cause of the problem, not just treating the symptoms. Digestive issues, acid reflux, heartburn, burping, gas, bloating. Come see us, folks. We're really good at that. If you have arthritis, if you have joint deterioration, we have a medical division. You might want to consider something called PRP. PRP is we take your own cells, spin them down, take out the platelets, your blood, and then re-inject the platelets back into the body. Now, the older you get, the less platelets you have. We might want to augment that with something like exosomes or something like that. But PRP is amazing, and I've seen amazing results with it for everything from pain to disc degeneration, even erectile dysfunction. Because it regenerates, it grows new blood vessels. Women, if you cough and sneeze and pee yourself, that might be something we can do PRP with as well. Hair replacement. It's amazing what PRP can do. And the thing that makes us different than everybody else is we have the medical division, we have the chiropractic division, we have the nutrition division. And so we try to get to the cause of your problem the best we possibly can. So if you want to make an appointment, you can do it right online, drjoe.com. You'll see a map of all our offices there. Just click on the map and you can make an appointment. Normally, the first visit is $375. That's an exam, x-rays, consultation, your first adjustment. And then on the second visit, going over the x-rays and the nutrition evaluation, and then we'll give you a treatment plan. Normally, it's $375. We've reduced that to $249. We accept insurances. We accept car accidents, sports injuries. Folks, if you've ever been in a car accident, I'm begging you, please come see us as quickly as possible. The longer you wait, it's going to affect your health. It's also going to affect your case. So you want to make an appointment, drjoe.com. I'm Dr. Joe Esposito. Thanks for tuning in. We'll be right back.